Welcome back to the podcast, Heal Without Harm. My name is Dr. Clayton Durr, physical therapist, and the one bringing you the truth about the medical system. Today's podcast is a unique one. The person that we're going to be talking to is Camie, and she wears a lot of name tags. I'm going to list off some for you here. She is the owner and founder of JoyLab Fitness and Social Club here in Wichita, Kansas. She is also a wife, a mother, a breast cancer survivor, and a Wichita attorney. And so we're going to go down a couple different avenues here on what she's done in her past, things that she's been through, and then what she is up to today and what she's bringing, what she's brought to Wichita and will continue to grow. Camie, thank you for coming on.
Yeah, thanks for having me.
Let's go back to what I found when I was researching you. My goal was to not know too much about you so I could be very genuine in my investigation and interviewing today. And the first thing that popped up when I used AI to assist me on this was that your father was a local legend in regards of being an attorney, which you are also an attorney. And so I'm curious if you could tell me a little bit about your dad and then maybe how that shaped you into becoming an attorney that you are now.
Sure. So he's actually my stepfather.
Okay.
But he came into my life when I was in second grade. So it was always a part of my life. I have a paper that I wrote when I was in second grade that said, like, where do you want to be in 20 years? And it said, I want to be a lawyer or a teacher and a mom with at least 2 kids. But anyway, so that, I guess his influence had been around me for all my life until I went to law school. And so, you don't really realize when you're growing up, I don't know, how great your parents are, how amazing the things that they've accomplished in their own lives. So once I got to law school, I knew that I knew that he was a good lawyer. And
but we always think about that of our parents, right? He was the best lawyer in your eyes. And then you come to find out, like, no,
he really was. So so my last name at the time was different than his. So no one made the connection because I went to law school where he went to law school.
Okay.
But that was purposeful. I didn't want anybody to know that we were related and kind of make my own way. And so, but then I was in a torts class, which is a type of law, but that's what he practiced, was also personal injury and product liability. And so we start learning about his cases in our books. And then I was like, okay, yeah, he's really good at what he did.
That's wild.
So it was really cool. But he did amazing things. Like he had toxic shock cases, which was caused by Playtex tampons. Yeah. So the tampons were taken off the market and redone to be safer for women.
Wow.
He had a case, and because of it, it was about birth control for women and the amount of estrogen and different things. And so that was reformulated to be safer for women. He had a case against Texaco where proved that benzene caused leukemia. So
what is benzene?
It's in the gas. It's in gasoline. So now at the pump where there's that rubber piece, or like when you put the nozzle into your gas tank and then there's that rubber piece to
like a protector
keep
thing.
Fumes from escaping as much. That was a result of one of his cases. So things like that. So he did really great things for the world. So it was cool.
It sounds like it.
Yeah.
And then I saw Gerald. How would you say his last name?
Michaud.
Okay.
Yes.
So Gerald Michaud.
Yes.
That's interesting. That's awesome. So I eventually want to get through you becoming a lawyer. What kind of law did you practice? And then into the breast cancer story. And then we'll finish out with how you're impacting the world now with JoyLab.
Okay.
And so if you don't mind, where did you go to law school? And then what kind of law did you practice? Or I guess you still practice. So
yeah. So I went to Washburn Law School in Topeka.
Okay.
That's also where Jerry went to law school. And I had grown up, going there and just hearing all about what he loved Washburn. He played football there.
Awesome.
Got his law degree there. Played collegiate for their college bridge team. Anyway, he loved Washburn. So I don't think I could have gone anywhere else.
Yeah, you would have been potentially disowned.
Exactly. So I went there, and actually he did not want me to go to law school. Or if I went to law school, he didn't want me to go into the same field that he did, just because he said it was so much work it took so much time away from his family. And I got to enjoy him in his later years of life. So he could be more present for my childhood.
Yeah.
So that was, he'd made it through the really difficult times of practicing law for him. But so I went to law school anyway. I was going to be an agent for professional athletes. That was the reason I went to law school.
Do you have to be a lawyer to be an agent? Okay.
You don't, but I think it's helpful if you are.
Okay, just because you understand like
you can read
contracts
the contract.
And all that.
Yeah,
okay,
you can do all that. So went to law school along with, he became my husband. We both went to law school to become agents. And after a few sports law classes and different things, we realized that it was a little bit more cutthroat than we wanted to be. And you have to break the rules, and we're not really rule breakers. And I was like, I'm not risking my law degree for anything because this has been the most difficult thing I've ever done. So that kind of evolved. We knew we wanted to live in Wichita, just different things.
And there's not much sports here.
There's not, you can probably do it, but it would be difficult.
Yeah, you'd be doing a lot of travel. Again, taking away from the family that
Exactly. So, he works at Martin Pringle Law Firm here, doing business law, and I do personal injury. So I followed in Jerry's footsteps.
Yeah.
But got to work. He came out of retirement when I graduated from law school to work with me.
That's fun.
And so we got to do that. And yeah, I spent most of my days in his office just listening to him talk on the phone and, talk to clients and draft letters.
How long were you able to practice together?
4 years.
Gotcha. Not long enough.
Yeah, definitely not long enough, but it was amazing.
Yeah, I can only imagine.
Yeah.
It's interesting. I'm only the ripe age of 32, but when you see things kind of come full circle, type of thing, like you said, going from second grade, not only to like following in his footsteps, but actually being able to work alongside him for a while and learn from him, type of thing. What do you think it was about him? You can answer one of two questions. One, like, what about him made him great? Or what was like one of the deepest things you learned from him? Maybe in life, because I think there are a lot of things about being a good lawyer is also probably like life stuff in regards to communications. But what do you feel like was one of the biggest takeaways you had from him?
You're going deep quick. He was amazing at understanding the human condition.
What do you mean? Like whatever injury they had, or the human
everything,
themselves?
what they were dealing with, how they were feeling, how other people would be reacting to them, to the empathy. He was the most generous person that I've ever met. And he instilled that in anyone that was around him, really. He just had a way of, he was very intelligent, so that helped him in his law practice. But he just had a way of, I don't know, I think everyone who was around him felt like they were the most important person, which that's an awesome quality to be able to have. But yeah, I think the way that the empathy that he had for people, and being able to put himself in their position, I think that's, not always easy to do. And I think becomes harder the more successful you are.
Yeah.
And,
because your bandwidth starts to get taken up and it's hard to.
And things that used to be, really difficult for you, feeding your family or, buying a car, just little things become not such a big deal to you, but he still had that. Like,
he could keep it a big deal.
He totally kept it a big deal. I mean, and he would say when things were, going well, or we were celebrating a verdict or some big thing, he'd always say, I wonder what's happening in Morganville, which is where he was from. Little tiny town, So, I mean, even in those big, huge moments, he's still thinking about where he came from.
Yeah.
So.
So with that in mind and trying to juggle a lot of things, like I said at the beginning, you wear a lot of name tags. One of them, unfortunately, and is the fact that you were diagnosed with cancer, but very fortunately that you were a survivor. How long ago did that diagnosis come into your life? How did things unfold in regards of having symptoms that led to the diagnosis? And then walk us down, like, what was that like being a mom, being an attorney, being a wife, and then also coming down with that?
Okay. And if I start talking and forget, remind me what the order of things that I'm supposed to be talking
no
about.
worries, no
If
worries. I'm really good at asking 7 questions in one.
Okay,
And
right.
So,
and I'm like, what else did you say?
We'll go with this. Take us back
Okay.
to what were some of the first symptoms and about what year was this?
Okay. So this was December of 2021.
Okay.
I had no symptoms except I was getting ready for work one morning and I was laying in bed just doing some stretching and I felt a lump and I was like, I hadn't noticed it before. And so it was about time for my annual mammogram. I was 43 at the time. And so I called and got scheduled for my, bumped up my mammogram a little bit sooner than it would have been. I mean, like by a few weeks. I don't have any family history of breast cancer. I was I am a healthy person. I was still a healthy person, even though I had this tumor. But, you just kind of go through your mind about, I breastfed my kids and I stopped wearing aluminum deodorant.
Yeah,
and
you did like all the right things.
Yeah, you think. And so went for the mammogram. There was nothing visible on the mammogram. But because I had felt a lump and made them aware of that, they did an ultrasound. And then I had to have a biopsy. And this was all on the same day.
Okay.
And I was freaking out,
Yeah.
and my husband was working. And so I called my mom and she came up to the facility, but couldn't come in with me. So it was like, back to back to back, like right away.
Because this is still like nobody, like you're going in by yourself.
Yeah, going in by
still
myself.
Like very freshly COVID, post-COVID, kind of.
Yep. And so they did the biopsy and I said something to the tech, like what's the difference? Like what can you see in something that's cancerous versus not? And she told me that she made a comment that not purposefully on her part, but just because of my medical, knowledge from the cases that I have done. I knew that she was talking about me and what she noticed, showing that there was blood flow to the tumor. So it wasn't like a cyst or something.
Okay. That makes sense.
So yeah, so that, and then you wait for the biopsy results.
How long was that?
That was a day or two.
Okay.
And I remember not hearing from my doctor about the results. So I was at work and I called his office and he had been in surgery all day. So he called me when he got in his car. I mean, I totally can remember the conversation. And he said, I haven't seen the report. I talked to my nurse. This is what she said. Great news. It's just DCIS, which is sometimes considered stage 0. Was
that still a cancer diagnosis? Is
yes.
this super, super early?
Yes. Okay. And he said, it's treatable. This is best case scenario. So I was like, okay. I mean, it was still totally devastating.
Yeah. You're like, hey, this is really bad news, but it's like really good bad news.
Yeah.
Was the way he was delivering it.
Yeah. So, I called my husband and my mom and had to go to my son's basketball practice that night because that was already the plan. And my husband was going somewhere with our other kids. And so I went to that and my mom showed up to talk there. And yeah, it was a difficult night, but I didn't want to let my kids know that anything was different.
Mm-hmm.
So that was hard.
How old were your kids at this time?
My oldest was a freshman in high school.
Okay.
Then my middle would have been in 7th grade, maybe. And then my youngest was in 4th grade.
So you had 3 kids instead of 2, like you had written down in 2nd grade?
Yep.
Gotcha.
At least. My paper said at least 2 kids.
Gotcha. But yeah, those are hard ages because you it's probably plenty hard to even hide it, right? Like it's not like a younger kid where you can hide it a little bit easier potentially.
And for me, we tell our kids everything.
Yeah, wide open.
We talk about, I mean, they probably know way more than they should know, but that's just how we are as parents and have always been. So I was like, that was my first thought, is how am I going to tell the boys? Mm-hmm. But going back that night, I just had this feeling like I need to see the report. I need to see the pathology report myself. So I woke up that next morning and the only thing on my mind was get the report.
Yeah. I mean, how could it not be, for sure?
So they sent me my report, and I had DCIS, but I also had invasive ductal carcinoma, which is a more serious diagnosis, and not the best case scenario. So that was difficult because I went from, okay, it's going to be, I'm going to be okay. It's DCIS. It's not a big deal. I can totally deal with this, to, okay, this is serious. It could, your range of treatment could be vastly different from just, let's have a surgery and remove it and be done.
Yeah.
And mine was vastly different.
What becomes the next step, or where do we go from there?
That's the hard thing that, if I could change something, it would be that, because I just felt like I was out there on my own, like didn't have any direction of what to do, who to call, anything. So I called my doctor, and luckily, because I, have been in the field that I'm in, I had doctor friends that I could call. So because of that, I was able to call them, and they kind of directed me. So, I started off seeing a surgeon and started off seeing an oncologist.
Was that all here in Wichita still at that point?
That was here in Wichita at that point.
Because I know sometimes we have to travel to KC or something like that to get.
I did do that.
Okay.
Yeah.
What ended up becoming the next path? Do you go straight to surgery? I've coincidentally recently worked with 2 or 3 ladies that have been through breast cancer, different ranges of what they went through, whether it be surgery and radiation and all that kind of stuff. So what are those next steps in regards of treatment?
So I had surgery.
Okay.
And then from there, they now have the ability to test your tumor.
Okay. And
see if you would benefit from having chemotherapy or not, depending on the stage that your cancer is at the time. They can test it, or, if it's a certain stage, they don't test the tumor. But anyway, I was stage 1A, which was wonderful, wonderful news. If you're looking on the terms of 1, 2, 3, stage 3, stage 4. So being 1A was a good thing. They tested my tumor and found that because of my age, because I was so young, that I did have an increased benefit with chemotherapy versus if I would have been 50.
Okay.
So, that was something I had to decide if I wanted to go that route or not.
How do you make that decision? Like what?
A lot of research.
Research on your own, and then also asking friends and stuff?
Yeah. Research.
I guess doctor friends was my what
research.
So
yeah, I researched.
Does it just come down to almost like a numbers game where it's like percentages of like this or this has a high chance of helping, or what all kind of goes into your pro-con list?
I think for me, I probably, not everybody's going to handle it the same, but my background and my livelihood is based on research.
Yeah.
And researching cases to prove a case or to disprove it, So that is 100% where my mind went. My husband said during this process that I was working on my PhD because really I would say from December 1st until the end of January, which was after my surgery, I didn't do anything but research, like until midnight. And then I'd wake up and in the middle of the night and I'd research. And so that was just the way that I dealt with it. But what I looked at is I had the initial thought that my body would be able to heal itself. That was the first thought that I had in my mind. And so I knew that with science, and with these outside things that I could do to support my body, that I would have a better chance. And so for me, I'm a science person too, in the numbers and that, so I chose to do chemo just because I also know how my mind works. And if there is this one thing that's available that I could have done that I didn't, and something came back or happened down the road, I'm not sure that I would deal with that as well as thinking that I tried what I could.
For sure.
And hoped that it was the right decision.
So between diagnosis and surgery, about how long was that? It sounds like a matter of weeks.
Diagnosis was the 1st of December and surgery was January 10th.
Yeah, so about 5 weeks-ish, right around a month.
And it seemed like forever.
Oh, I can only imagine. I'm sure the first 2 days waiting for just even that phone call from the doctor seemed like weeks and months, even though it was 1 to 2 days, like you said. How quickly do they start you on chemo after the surgery?
Usually about 4 weeks, but I had some other issues come up. So I didn't start chemo until the end of March.
So about 2 to 3 months later, 2 months later?
Mm-hmm.
Would you care to share some of the complications?
So I ended up going to KU for a second opinion. And
post-surgery?
No, before surgery.
Okay.
Before surgery, thankfully. And anyway, so I asked that doctor, I said, do we need to do any additional scans to see if it's spread or and he's like, based on your biopsy and this, and we're 99% sure, like to do additional scans there's a 20% chance that scan would give you a false positive of something else. So I don't think we need to do that. And I was like, okay. And so I had an oncologist here and went to him because I wanted to get his opinion on whether or not I should do chemo as well. And so came back to him and he gave me the exact same opinion on what he thought my treatment plan should be. And so I ended up doing the chemo portion of my treatment here in Wichita. And I asked that doctor and he said, we need to do a scan. And I was like, no, like doctor, my doctor in Kansas City said that it'll bring up things that aren't an issue. And he was like, true, but I want a baseline of your lungs or, let's just do an x-ray. So we did that. It led to showing a haze on the x-ray. So then because of that, I needed a CT scan. So in between this, I'm waiting every week for these results. I mean, it was such an emotional roller coaster. It was crazy. So I then had to have a CT scan. There was nothing except my thyroid was enlarged. So that was the issue. So then I had to have a thyroid ultrasound and then wait a week. And then I had to have a thyroid biopsy and then wait a week. And then it was just
so not only emotionally, but is there still some consideration through this path that you're waiting for your post-surgical, waiting for chemo?
Yeah.
And you're delaying intervention. And
right.
So there's potential drawbacks and negatives there, correct?
No.
Okay.
I mean, you would think so, yes. And you probably feel that way on the inside. But the medical community believes that you have, I think it's 4 months from surgery to begin chemotherapy to have the maximum benefit.
Cool. So it's not like you're
I
like
was
going up on the
still
risk
within
chart or
that
anything.
timeline. But, you know, to me, it was, are these things happening for a reason? Am I not supposed to be moving forward with chemo? Is that why I'm having all these delays and roadblocks? So that was a big thing that I had to deal with because I do believe in, having signs and yeah.
So did this end
So-
up going somewhere to where you find something? CT scan, thyroid?
So I had a huge nodule on my thyroid. So then they biopsied that and it was not cancerous.
Positive.
And so the doctor's like, we're just going to move forward. Like, this is something that obviously you're living with, you're okay with it. And so but then I went on spring break. I talked to the doctor and I was like, I'm good with doing chemo, but I am not missing spring break. Like, I'm going. So whatever I need to do. And he's like, just go on spring break. He was like, one more week won't make a difference. I want you to have an enjoyable time. It's your first round. We don't know how you'll handle it.
Yeah.
Go on spring break. Went on spring break. The first day that I got there, I was shopping with my mom, which was a love that I have, shopping, and that totally went away. Like, after my diagnosis, I had no desire to shop, to go into a store, to do anything. But so we went to a store and I was in the dressing room and I looked down and I had a little spot on my stomach. And I was like, what is this? So we got home and then I showed my mom and I was like, I don't know what this is. And she's like, yeah, I don't know. So I have a friend that's a doctor and I sent her a picture and she's like, oh, that's shingles. And so I was like, oh my gosh. So I called my oncologist. And he called me and he was like, yeah, it's shingles and you won't be able to start chemo for at least 2 weeks.
Goodness.
So it was crazy. It was crazy, but I still moved forward and felt like, one of the things that I really began to learn to do better was to trust my body and to trust my intuition.
Yeah.
That's what led me to getting my second opinion and having a different surgery than I was planning to have here in Wichita.
There's two different things that come to mind, especially since a lot of times you're probably advocating on behalf of your client because you'll take on cases that would have to do with medical, but also you did this yourself very clearly through the story you just told me, is just simply advocating for yourself and pushing your own envelope forward and not waiting for calls back, but making the call yourself. And that's one thing I've noticed with the clients that I work with as a PT is a lot of the times I'll be like, have you got those results back? They're like, well, they said they would call me. And I was like, when was that? And they're like 2 weeks ago. I'm like, call them.
Yeah.
And that sucks in our medical system that it tends to go that way. But that's one thing I really do my best to like push my patients to be like advocating for themselves, whether it be with the communications with me so that I can get the correct information or like give me the feedback on if you like this, don't like this, if it helps. But then also especially with other medical providers. And I think it really creates better outcomes as you clearly experience.
Yeah.
Like, this is the only reason I got where I'm going. But that's one thing I observed in a lot of them, but also in you. And I'm curious your thoughts as to what you would say to someone that has any medical issue. My ankle hurts, all the way up to, I think I have something that may be cancerous. What would you want to say to that person to hopefully lead them down a route like you took of being much more invested in your health and advocating for yourself?
I think the number, I'm not sure that I would be this way, but for, my upbringing and, being comfortable or learning to be comfortable challenging doctors. Because that was a huge part of what I learned growing up and what I watched and what I saw and what I watched my stepdad do for other people. So being able to advocate for yourself, but it's difficult. Like, you have to be taught it almost
given permission to.
Yeah, it doesn't just happen. I mean, even people that in my own close circle don't do it. And, I'm like, why are you on this medicine? Well, they told me I needed to be. No,
Yeah.
like,
Or why are you still on this
why?
medicine?
Yeah.
Like, sometimes too.
Or
Yeah.
do you even know? Like, do you even know why you're taking
Mhm.
it? So yeah, being able to advocate for yourself, but you do need to be taught. And maybe we'll have to have another podcast because I think there's something that I'm going to be working with that's going to help that, at least for women who have been diagnosed with breast cancer. So
Yeah.
I'm super excited about that and learning to be an advocate. I would say get a second opinion.
Oh, that was going to be my next
That's
question.
my number one thing that I would tell anyone.
With anything. Like,
With
nearly
anything. With anything, and especially something that is major life-changing.
Mhm.
And it's not mean. It's not disrespectful to the person that you've already seen. It's what you need to do to take the best care of you,
For sure.
So getting a second opinion would
Yeah,
be
'cause
my
my
number
thoughts are-
one thing.
Like, play it out, right? So, like, you go see Dr. John, and he's like, you have breast cancer, you have this, right? It's like, okay, Dr. John, I'm going to go talk to Dr. Sam and see if that's the same thing. And it's like, either one, they confirm, and
Mhm.
they're like, nope, Dr. John was right. That is the best plan of care.
Yeah.
Or they say, we're seeing something else. And then it's like, okay, we now have two different things. And then that's where, for me, and I think you as well, based off how you ask questions, why are we seeing something different? Like, is this scan different than that scan? Are you looking at it through a different lens? What's your plan of care recommendation? Why? Because at the end of the day, like, they can have their professional opinions, but you're the one leaving with the
Right.
treatment.
Yeah.
And I even tell my patients this, where it's like, here's what I think I would do, or here's what I recommend. However, I don't live with the outcome.
Yeah.
So what do you think? And I'm a huge believer in, like, the intuition, where it's like, at least for myself, whenever I have a difficult decision in anything, it's like my gut's naturally pushing me one way or the other. And then it's like, well, is that accurate or inaccurate? And then I need more information. Or it's like, I think it's this, but I need proof that I'm wrong. Otherwise, I'm going this way.
Right.
And I try to reinforce that with the clients that I work with, of like, what's your gut saying? Like, I think we should try needling, or I think we should do this, or I think this is probably fine. We should leave it for a week and see how things progress. What are you thinking? And it's amazing to me how the look I get when I tell them that.
Yeah.
What do you think it is? They're like, I don't know. You're the professional.
Yeah.
You're the one who lives with your body. What do you think is going on? Or I know you've Googled stuff. Like, what are you finding?
Yeah.
And I can see, like you said, your friends don't even either challenge or ask for a second opinion or know why they're on things. And I would say that's, like, incredibly true with most people I work with. Of they're dumbfounded when I ask them what they think it is. Like, what?
Yeah.
Like, I can have a say? And it's like,
Yeah.
yes, please. Like, please tell me what you're thinking. What do you think we should do?
Again, I think that's something you have to be taught, right? You have to know that that's an option. So one of the great things from all of this is my kids, like, I do that with my kids. Like, they play a lot of sports. They have, aches and pains. And I say, what does your body need?
Mhm.
And I remember clearly the first time I said it to my son, I'm like, what does your body tell you? And he just looked at me and he's like, Mom. And I'm like, no, just sit there for a minute. What's it tell you? And he looked at me and he goes, rest. And I was like, yeah, you're nonstop. You're doing multiple sports. And so after that, I think and he was like, when he was kind of like, and I'm like, if you will just sit in stillness for a minute, something will come to your mind. Like, something will. Either my mom's freaking crazy, yes, which is probably true, or, oh my gosh, I did. I have an answer. But then you have to learn to trust that.
Yeah.
And I think, one, just being exposed to that's a possibility, that our bodies know so much and can tell us so much if we listen and if we learn how to listen. Like, it's not innate, I don't think. I mean, it probably is, but
I think you have, like, a predisposition, as you're born and grow up, but it's definitely something you can grow significantly or ignore and move on, unfortunately.
Yeah.
But I would agree with you. And that's one thing I've learned with my job. My wife does a good job of, like, stoking those kinds of things of, like, well, what do you think? What should we do? And, like, challenging it. But yeah, I think it's scary to challenge things because you don't know if you're going to get punished for it of some sort, or reprimanded, or, like, the doctor gets angry with you or something. It's like, it can be scary. I totally understand. And If this podcast today does one thing, I hope it gives people permission to either ask more questions, advocate for themselves, or just simply get a second opinion.
Yeah, for sure.
So with you had the surgery, then we had chemo.
Mm-hmm.
Where are you at now? Like, I don't know all the terms of remission and all that kind of stuff.
So then I had to have radiation.
Okay.
Also, not had to, but because I chose to have a lumpectomy instead of a mastectomy.
Which is when they take just the lump as opposed to the whole breast.
Yes.
Okay.
And so because of that, I knew that by making that choice, that radiation was part of that plan. So then I had radiation, which was probably actually more difficult for me mentally than the chemo was. I don't know why. It was just, mentally it was rough. I don't know, I guess because I had those few minutes every day to just lay there and realize what was happening to me.
Yeah.
So anyway, so did that. And then I think technically once they remove the cancer, then you're considered to, I don't think they ever say cancer free, but no evidence of disease.
Yeah. Got to be technical on lingo, right?
Right. NED. But yeah, so now I'm on a hormone blocking medication because my cancer was hormone positive. And so I take that and I go to the doctor every 6 months for a mammogram or an MRI.
Yeah.
And on that point, so my cancer wasn't visible on a mammogram.
I was going to ask that because you mentioned that even though you felt the lump and you took the ultrasound.
And the reason for that is because I have really dense breasts.
Okay.
And when you have dense breasts, it's a lot harder to see. And so just recently, within the last year or so, the FDA has now made it a requirement, I believe, to notify the patient if they have dense breasts that they may need to have some other form of a scan or something to really rule out the possibility of breast cancer.
Because it points out the flaw in the mammogram and saying that there could be a lot of false negatives essentially going missed. Like, I mean, you had the textbook example of why that should be, right? Because you would have been cleared. If you didn't feel it and advocate for more, then they would have been like, you're clear.
Yeah.
And then that's another year that the cancer could have continued.
And I didn't know that dense breast, I didn't know I had dense breasts. Like I didn't know that was a thing. Didn't know to ask for more. So that was frustrating. And to me, it's also frustrating that when you go in and you fill out the paperwork before your mammogram, they ask all these questions about your history. 80% of the people that are diagnosed with breast cancer don't have a family history. 80%.
That's a vast majority. I think definitively it's an extraordinary majority.
So I don't know, as a woman, it's always like, oh, do you have a history of breast cancer? Nope. Okay, I'm good.
Yeah.
I don't have a history. Like, no, I don't need
honestly, it just points out that it's a fairly poor screening process, right? Because it's like they're giving out a lot of false negatives, potentially. And then if you have this massive majority of these ladies not having the history, then again, you're going to overlook them.
Yeah.
And so then it can potentially get worse before
or being
it's
young,
noticed.
The average age is 65. I was 43.
Yeah.
And now I have several friends that are my age and younger. Like I don't know if it's just because I'm more aware, but it seems like it's happening more frequently with younger people. So, but so I would say figure out if you have dense breasts. Get another, you can do an ultrasound, you could do an MRI. There's other things you can do besides a mammogram or in addition to a mammogram, which I do in addition to a mammogram because I'm like, well, if it missed it the first time, why do I need to keep having a mammogram? I would lack faith in
it quite a lot.
Yeah, but all of the doctors that I've spoken with think that it's still a beneficial thing because it can help notice changes maybe. But so doing that and then I think the most important thing is self breast exams.
Yeah.
Because I wouldn't have felt a lump had I not done that.
One of the gals that I'm working with, her initial thing was like, it was just itchy. Like there was no skin change. There's no visual change.
Yeah.
she didn't tell me. This is me just asking as we were going through PT, so there may be more details, but she's like, I just had like the side of my breast was itchy all the time.
Huh.
And so after like a certain amount of days or weeks, she like went to the doctor and then ended up finding some sort of breast cancer. We haven't talked to this detail.
Yeah.
But it's just like, I don't know, cancer is just like such a wild card on like how it will show up. Like I know in school, for PTs, we learn like, hey, if the person's lost weight and they haven't been trying, that can be one. If the pain is whatever, so they come in with back pain, if it's like, it's worse at night, like no position changes, it just hurts at night. Like they pretty much say, if you have a weird symptom, they label it and say like, maybe refer on, for some sort of potential cancer, and then you go investigating. So I do think it's very important, the more you know about yourself or what is and isn't normal, and then advocating, being willing to go to the doctor and be like, hey, can we investigate this type of thing. So you get finished up with this, and then JoyLab becomes a thing. So if you went through surgery, chemo, radiation, you're still finishing up in the year 2022. Am I correct on that?
Yes.
When did you decide that you wanted to make something like JoyLab? Has it always been a dream? Did it completely come to fruition post-cancer? Where are we at with that?
It was not always a dream.
Okay.
I thought I was living my dream life,
for sure.
Before.
I mean, you checked most, if not all, the boxes from the second grade prediction.
So, yeah. So when I was first diagnosed, I don't know how to, I don't want to just make this too long, but I could talk forever about all of the steps and everything. But so I was going to a gym that was called OptiLife, and it was an amazing space. And I felt like their vision was to try to care for the whole person. And so I immediately, first of all, the day after I was diagnosed, and I'm like, how do I tell my kids and do all this? Went to Watermark Books, and they helped me find some books, and which was amazing. But I was on a walk with my mom, and I was like, I've been training for this. And, she just kind of looked at me, and I was like, I have. So she had taken me to a health and wellness retreat. And that was for my 39th birthday. And then we went back and did it again for my 40th, my 41st. We skipped my 42nd, and then I was diagnosed. But I felt like I had done all of these things to try to do a better job of taking care of my body and teaching that to my kids.
Yeah, absolutely.
And so this space, OptiLife, so I immediately started doing daily infrared sauna that they offered. There was a yoga teacher there who did some breath work, and I don't really even know what she did, but I just talked with her and, kind of helped me kind of go inside my body and try to figure out what it was telling me, what it needed, and things like this. They had a nutritionist there. There was a person there that did massage. Anyway, so they just, in addition to having Pilates classes and, cycling classes and weights and all of those things. So I really loved that space and the people that were there. And the one thing that I was told by all the medical providers was to continue exercising. Yeah. That was the one thing so I did. I mean, in the days that I didn't want to, my mom was like, get up, we're going to the end of the block. Let's go.
For sure.
And so thank goodness for her. So keeping that movement and having that, I had a, Pilates class that I would go to and had a group of ladies that I was really close with. Anyway, so that closed, shut down.
Yeah.
Right before I was getting ready to start radiation. And I was like, what am I going to do?
Yeah, this is my lifeline.
This is my place. Mm-hmm. This is it. And I didn't have a lot of other things that interest me at that time. Like I wanted to be with my family. I wanted to be outside in nature. And I wanted to go
Yeah.
to my Pilates
Is one of your
classes
three
or
constants.
yeah, it was totally. So I was like, what am I going to do? And so I texted my Pilates instructor and said, I don't know what I'm going to do. Like, this is major for me. Can you come to my house and teach me and my mom? So she did. So we started doing bar classes in my basement.
That's awesome.
And I knew I would never find another place like OptiLife. Just what it was. I mean, it encompassed so many things.
Honestly, I feel like it was ahead of its time for Wichita.
Yeah, for sure. I agree. And so I didn't really think about it. But then when I got into treatment, and I didn't know what to do and I didn't know the next steps and I didn't have anybody to really guide me, I was like, after it closed, I was like, if I win the lottery, I'm buying this building and I'm going to have a place for cancer people who've been diagnosed or dealing with it. And then I was like, well, maybe we can get the people before they're diagnosed to learn some things that they could be doing to reduce their risk. And so I was like, but to have a place all in one where you get diagnosed, to go there, you see a nutritionist,
There's like a path.
Yes, you have a roadmap.
Mm-hmm.
So, that was a dream. I don't play the lottery, so that wasn't going to probably be
you have
a possibility. That wasn't a possibility. So I started thinking like, what else could I do? And then, the further out you get from treatment, I mean, the issues that you deal with and the fears that you have never fully go away. They just calm down.
Yeah.
But for me personally, thinking that I would be surrounded daily by others going through the journey was more probably than because I take it on myself, emotionally and everything. So I was like, okay, like I want to help those people, but how else can I do it where I'm benefiting more people and giving, really what I wanted to do also was to help my boys, was to kind of the ultimate goal became to have a space where people can use their bodies and learn about their bodies so that they can be prepared for a crisis before it actually happens.
Yeah.
And so that's kind of what I started thinking about, like, how can I do that? And what was important to me and what may help other people. And so, as I was researching and watching and podcasting and webinars and all the things as I'm going through treatment, there was that Blue Zones documentary that came out, and it talked about, longevity, and an important piece of that is the social aspect. And to me, there's not really a place that has that as a focus. And so my vision started to be, I want it to be fitness, but I don't just want it's not just about being fit. Like, it's about being fit in your mind. It's about, being fit, I don't know, spiritually, emotionally, everything. And a typical fitness center doesn't do that. Like, that's not what they focus on. I think
some create it on accident. I go to Compelled Fitness. It's a CrossFit gym. And one thing I've observed when talking to clients and telling them why they should work out, going through that conversation with them, I have now found about myself that one of the reasons I keep going back is more because I feel FOMO from seeing all my friends and from like hanging out with them. And there's certain people that I see there 3 times a week that I see nowhere else in life. And there's certain things that I've talked to them about or confided in them about that I may never say to anyone else. And so I've observed that the social aspect, along with the fact that I love the workouts and all that aspect, but I would say what I actually notice myself yearning for is more the social aspect of the gym. And I don't know if that was an intention necessarily, but I think some do create that by accident in a way.
Yes.
So that's where just the fact that it's JoyLab Fitness and Social Club, like it points out your mission immediately. And that's what drew me to it, because I observed the same thing on that same documentary, that it's the social aspect. And then they even talked about, I don't know if it was in that documentary or if it was another podcast about the same time, but they said one of the predictors of like longevity is relationships. And it's not how many you have, it's how deep they are. Like that was the biggest through line.
That was on the same one.
It was. Okay. Yeah. And I was like, this makes a lot of sense, because what you felt going through the cancer initially was alone, at least alone in what do I do? And it's like, that's when I feel like you need it the most. No, you didn't feel fully alone. It sounds like your mom was like amazing. And I know you have a good family too.
Amazing.
But,
amazing. Like,
yeah, but it's like, there's still so much that you yearn for. It's like when you need it most. And so I agree with you that when you say, I was training for this, I tell a lot of people that have been in accidents, car accidents, bad injuries, stuff like this. It's like, if you didn't train the way you trained up to the age of diagnosis, you probably would have had significantly worse outcomes.
No question.
And so what you did up to and throughout is the reason you had such positive outcomes. And I think people like you and me write that off. They're like, oh no, we just take care of our bodies. It's like, no, you were training your whole life, and then game time showed up with a breast cancer diagnosis, and you're like, I'm going to beat this.
Yeah.
But you wouldn't have done it if you didn't have like literally, like you said, fit across the board.
Yeah. Or it wouldn't have been like, I feel like I handled it with flying colors, and I don't think, I still would have handled it even had I not been training.
Yeah.
But I don't think it would have been the way that I did, which I'm really happy about. And just to, I don't know. I agree. I think that most places that are social, that are fitness centers, I think that social aspect is a huge part of all of them. And I think people go back for people.
Yeah.
So I don't think I'm different in that way. I just think the other things that we offer are not available at other fitness centers.
I agree.
I think every other place has a community in mind when they're building whatever they're building.
No doubt.
So
I do enjoy how much you shoved it to the front aspect, though.
Yes.
I really liked that.
Yeah. So I just wanted to, not say, oh, I'm so different because I'm doing this. I'm so different because I'm doing these other things that I don't think they focus on, which is
fine. That's why people go to each gym for their own flavor.
Yeah,
right?
Exactly. Had I not been through what I've been through, this would not look the way it does.
Absolutely.
So,
well, and I've heard one of my favorite phrases is, "We are most equipped to help the person we once were." And so, again, in second grade, you didn't write down that you were going to build a gym, but you didn't know what was to come.
Yeah.
And you didn't. I didn't even know until it's interesting how all this works. Literally, I didn't really know many, if any, people who had went through breast cancer. I've met 3 in the last 2 months.
I know.
So it's weird how these things happen. But what I heard on all 3 of them were variations of what you just told me, in regards of not knowing what was next, or sometimes feeling like this, not loneliness. That's not the word I want to use.
Oh, I felt it was very isolating to me.
And it's like, okay, so that sucks. Why? But why would I even know that that's a problem? You know what I mean?
Yeah.
It's like, I haven't been through it. And now I know people who have. So now my brain, I won't be able to shut it off. I'll be pondering how to fix that, right?
Right.
But you have to be exposed to the problem before you can fix it. And so when we look, forward ahead and, what were you meant to do? It's like, this is clearly one of the things you were meant to do, but you weren't ready, prepared, or even aware of the problem to be fixed yet.
Yeah.
Kind of thing.
Yeah, definitely. It's when I started, I had that blog, Mom Life Simplified.
Yeah.
So I started that, and I didn't need something else to do to fill my time.
Hold on, I have to spare 47 seconds today. I'm going to fill it.
I just had so many people were like, send this to me, or do this, or tell me that, And so as I was doing that, though, I had this feeling on the inside, you have something to share, but this isn't it. This isn't deep enough for what you need to do. And it just was, it was reoccurring in my mind. This is great stuff to share, but people need something more.
It's not
and I just
aligned yet.
never knew what it was. And then I got diagnosed and I was like, okay, this is what I need to be sharing is how I'm going to do this. And it wasn't a daily thing. I wasn't posting often, but I did post about some of the stuff that I was going through. So that it was kind of interesting though about, how you said, I don't know, teaching or working, you're educating the person that
Oh, yeah. Yeah. We're most equipped to help the person we once were.
Yeah. And so just, I don't know, it was just really interesting how that kind of came about. Like, I never envisioned that that's what my Mom Life Simplified blog would turn into.
Yeah.
But I felt like that what I was able to share was more helpful to people than just here's a good dinner recipe. But I need all of those too because I really don't like making dinner.
Yeah.
So
how long ago did you open the doors here at JoyLab?
Just a few months.
Okay. I knew you were fresh, but I wasn't sure how fresh.
So in December, we opened, soft opening.
Okay.
So it's just been a few months.
Solid. Are you going to have a grand opening or did you have one?
Yes, I'm going to have a grand opening.
When is this?
The grand opening is going to be April 25th.
Okay.
Yeah.
What day of the week is that? I'm guessing
April
a Saturday.
25th. That's a Saturday.
Okay.
And I don't have all the details, which it's now April 1st, so I should probably get a move on that.
We can get those
that's
down
the
in the
plan.
show notes.
Okay.
So what all do you offer here?
So we offer yoga,
okay,
Tai Chi, mat Pilates. We have some pop-up bar fitness classes, cardio dance, and sound bath.
Tell me about the sound bath. This is one that's popped up here and there with conversations I've had with clients. I've heard all positive things.
Yes.
I think it's something that everybody is probably skeptical of or like, what the heck is that?
Yeah, for sure.
But the two people that I've heard that have done it, they're like, I thought it was bogus. I walked out bawling my eyes out and I've never felt better.
Yeah.
I've heard weird, but great experiences.
Right.
So what are they and what do you like? What is it? I guess.
A sound bath is you will just come. We have super cozy blankets. You'll lay on a yoga mat. And then the person who's leading the sound bath will play different instruments, crystal bowls.
Yeah, that's what I remember hearing.
And some chimes and a gong and a drum. I mean, it depends on the person who's leading it, what instruments they use. But they will play those instruments while you're laying there. Basically, it's kind of, the purpose is the vibrations from the sound and the frequencies. They activate your vagus nerve. So it puts you into a really deep state of relaxation. And the frequencies are healing your cells from the inside. So it can help with pain relief, with stress reduction. It can bring up some emotional things that you weren't even aware of. So when I come to sound bath on Sundays with Blake.
What time?
At 2.
Okay. Asking for a friend?
Yes. So he does his sound baths a certain way and he always hits the gong and I'm awake. And then when the gong hits, I don't remember until I hear these little chimes that he plays at the end when it's over every time. And so I was like, isn't that so weird? And he was like, no, the gong is supposed to open your subconscious to go to a deeper level. And so it's amazing. My dad, my biological father, was a bull rider, a rodeo clown, a horse jockey. He's had like 30 surgeries, is in pain always. He does not miss a sound bath. He comes and he says that this is the hour that he can lay here and not be in pain. And when he gets up, he always gets up and he's like, my shoulders don't hurt.
Yeah, that's awesome.
So, yeah, it's amazing. And I had my the second, but my first experience where I was in a sound bath. This was just a couple of weeks ago and I had pain in my upper middle back. And while I'm laying there, my eyes were closed, but I could feel my body like moving, like it was unwinding. And with my eyes closed, I could kind of like see this spiraling. So I opened my eyes like, am I alive? Is everything okay? This is weird. And then afterwards I got up and I was putting all my stuff away and I was like, oh my gosh, my back pain's gone.
That's awesome.
It was crazy. Yeah. So
we'll finish with this because I've found that it almost seems that most physical pain that we work with somehow ends up roping back to you're just treating the brain. Now, there's of course like tendonitis or a tear, like there's a physical change
Right.
or mechanical change or physiological change. But like you said, even like your dad, like if there was a true straightforward, there's inflammation here, there's tendonitis type stuff, then the sound bath wouldn't be so powerful to him, right? Because you can't just make that go away necessarily. Now, I'm not saying that it's not there or it is there, but my point being is the way your brain perceives or reacts to the signals that it's getting from the body is pretty much everything. I think we can all think of a time that we shut our finger in the door, cut ourselves, didn't know it, burned ourselves, didn't know it until we saw it. Like the physical change was taking place. Like my thumb, I've shut my thumb in a car door and walked off. And then when I couldn't keep walking is when I realized it. We could all agree that damage was done, but the pain hadn't hit yet. And then oftentimes there can be the opposite. You can have pain, but no physical damage. And so usually people who are specifically in chronic pain, it's somewhat a learned behavior, not a behavior that you're necessarily fully conscious of any sort. But you start to realize that like, oh my gosh, my alarm systems are a little bit off, or like I'm used to feeling pain, so my body just like almost keeps it there in a way. And something like a sound bath, I think, taps into that and taps into like some of the changes where you can let go. And I think sometimes pain that you feel specifically in your back, whether it be hips, low back, upper back, neck, sometimes that's those muscles learned behaviors to stay in a state of tension. And when you're in the sound bath, like your experience, if I had to like tell you what I think was probably taking place, somewhere in your brain, subconscious or body, you finally got permission to let go, whether you know what it was or whatever.
Right.
And so the muscle's like, oh, okay, I'll finally chill out. And it got permission to no longer stay contracted or spasmed. And that's where it's like, not that at times like this, I'm like, can we just have everybody try a sound bath? Like literally every human
Right.
in the world.
Right.
And then just like retest everybody and see what percentage of them no longer have pain. Because
Yeah.
I bet it would be pretty prominent.
Yeah.
Kind of thing. And then if that worked once but only lasted for 3 days, then you can take what your dad does and like never miss it. Like
Yeah.
treat a sound bath, treat meditation, treat exercise like a medication and be like, I'm going to take a dose of 1 time, 3 times a week. And we're going to see how my body responds to that medication and that
Yes.
dosage.
Yes.
And if it's positive, keep doing it. If you need to ramp it up, ramp it down. You start looking at it that way. And like people generally won't miss pills if they're told to take them every day, but
Right.
they'll miss exercise because they discount it, even though
I know.
research shows exercise is dang near a cure-all or at least improve all
Yeah.
among so many different things.
Movement is medicine.
It truly is. And Ivy, there's one person that said that's actually an insult to insult to movement because it's far better than medicine. I was like, that's a
Yes.
good point. I
Yeah.
like that a lot.
But I think for the typical person that, that's the first
Mhm.
thought is, oh, is there something I can take to help this?
Yeah. It's like,
Yes.
yes,
Yeah.
an hour of exercise.
Yes, an hour.
3 times a
And
week.
it's within your own power.
For sure.
And it's free,
Yeah, absolutely.
generally.
Mhm.
Like
Yep,
if
and
you need to,
yeah.
you can just walk,
Exactly.
So.
Okay. Grand opening will be on April 25th. This podcast will come out, I think, on the 6th. So just short of 3 weeks, the grand opening will be taking place. This is JoyLab Fitness and Social Club, located in Wichita on are we on Woodlawn?
2424 North Woodlawn,
Deal.
Suite 101.
There we go. All the information will be in the show notes for you guys just to go down and click if you want. Camie, there's one other question that a follower always requested.
Mhm.
I asked, what's your favorite junk food? Just ask everybody this.
BC or AD. So after diagnosis or before cancer.
We'll say all bets are off. Like just straight up, like if you could eat whatever junk food you wanted with no repercussions. And honestly, if you could do both.
Probably ice cream would
What
be my
flavor?
main thing. But now my stomach doesn't really love dairy.
Okay.
The main thing that I love my mom makes me is a date
You're
that
gonna
she
put butter
takes
in
the pit out and puts peanut butter in it and then drizzles a little Hue chocolate, which has no sugar added, on the top and then some sea salt.
That does sound good.
It's an
What was your
amazing
flavor of
treat.
ice cream though?
Mint chocolate chip and cookies and cream, 2 scoops.
Love it. Okay, cool. All right, so a date, peanut butter, some chocolate, and sea salt. Got it.
So good.
I'll be trying
Crunchy
that.
peanut butter.
Camie, is there anything else you'd like to leave people with today?
No, I think just realizing that our bodies are amazing, amazing, amazing. And if you give it the right tools, it's capable of so much that you don't even know.
I agree.
But you can come to JoyLab to learn more about how to, to go inside and have some of those tools.
Deal. Sounds good. Thank you so much for coming on. I appreciated having you and learning so much more. I'm also looking forward to where you're going to take JoyLab, because I think you're at the beginning of something really big, and we'll continue to help you in any way we can.
Cool. Thank you so much. I appreciate it.
No problem. Hopefully today you learned how to heal without harm.